That's Maywee. My name is Chantel Green. I'm with the Nez Perce Tribe Executive Committee, serving as a secretary as of right now. And we are here to give a public health announcement, and we have Dr. Hartwig with Nimiipuu Health as the medical director, who's going to give that report.
That's Maywee. I'm Dr. Hartwig, the medical director of Nimiipuu Health. I would like to take this opportunity to provide some insight as to what Nimiipuu Health is doing to prepare for this unprecedented situation of the pandemic of COVID-19, novel SARS coronavirus 2. The coronavirus is a new virus that was identified in Wuhan, China in December of 2019. A virus is a pathogen or an infectious particle that causes infection that needs a host to live within. It cannot live on its own. It multiplies unopposed for up to 2 weeks without our awareness as the virus penetrates or gains access to inside of our cells, and as I said, multiplies for up to 2 weeks. And after that 2-week time span, when the cell can no longer confine or hold those viral particles, then the cell ruptures and releases all of those viral particles into our body, which causes the symptoms that we often see with viral infections. With the coronavirus, we're seeing cough, fevers, and shortness of breath, and your body is overwhelmed with that infection, and it takes us time to mount an immune response to that. With the viral particles multiplying inside your cells, and an antibiotic, when given, is out in the bloodstream. They're in two totally separate compartments of our body, which is why antibiotics aren't effective against viral infections. And we recommend supportive care for this infection as well as other viral infections. People who have been infected with the coronavirus or COVID-19 disease, 80% of people have not manifested any significant illness that require medical care. They're showing signs of symptoms similar to a cold. 15% of people that have been infected are requiring some sort of medical care, such as ER evaluation or hospitalization. And 5% of those that have been infected are requiring intensive care, such as intensive care unit care. Nimiipuu Health has taken the following precautions to protect our community, our patients, and our staff. We have canceled all routine appointments and have provided refills for these chronic medical conditions to assure that care is continued during the state of emergency declared by the Nez Perce Tribal Executive Committee. We are actively attempting to set up telemedicine care, and that should be available sometime within the next week. We have altered pharmacy access and hours to reduce exposure, and the hours have been shortened from 8 to 4:30. Pickup times in Kamiai will remain the same, 8 to 4:30. Due to the risk of drug shortages, the pharmacy will continue to provide a 30-day supply of your prescriptions. To reduce the number of times that you have to access the pharmacy, we're trying to synchronize your prescriptions so that they can all be filled at a single time. We can send out text or phone calls letting you know when your prescriptions are available and ready for pickup. We have curbside pickup so that you don't have to enter the facility to place yourself at risks, because healthcare facilities are the greatest area of risk for getting an infection of any kind. If your family member or you aren't able to pick up your prescriptions, we do have delivery of prescriptions in the Lapwai and Kamiai area. We do need to know a physical address to fulfill that request. And if you live outside of the Kamiah or Lapwai area, you can have your prescriptions mailed. We have transitioned behavioral health entirely to telemedicine, and this infrastructure was already in place for one of our providers, which is why that expansion was a much easier task than for medical to provide telemedicine services, but that serves as a template for us going forward to transition the medical side to telehealth. Dental services are available for urgent or emergent needs, again for community protection. Community health continues to provide excellent patient services with medication delivery and MediSet preparation, for example. Optometry has made some alterations as well, but would like to know that they are available for acute eye issues such as decreased sudden vision changes or loss of vision, sudden onset of new flashing lights or floaters, pain or redness in or around the eyes, double vision, eye discharge, swelling of the eye injury or trauma, and the request for all of our facility, because we have locked our doors today for protection of spreading the virus, is that when you arrive to the clinic, you'll need to dial the main clinic number, 208-843-2271 for entry. If you have a scheduled appointment, we have staff readily available to open that door for you. Optometry is requesting calls also to abide by the social distancing recommendations that have been put forth. Our fitness center is closed during this time also to prevent and protect our community. We've had extensive collaboration with the Nez Perce Tribe and the Emergency Operations Center, which is ran by Incident Commander Marty Anto. This collaboration is vital for the preparation and response to the arrival of this pandemic to our community. We are also forming collaborations with surrounding health facilities and health districts during this time of need. We recognize that we have tribal members all over the reservation, as well as in close proximity off the reservation, who can benefit from our assistance. This unifying effort with the Emergency Operations Center and the Nez Perce Tribe is invaluable. The foresight that the Nez Perce Tribal Executive Committee has had to make recommendations for our community's protection, which go above and beyond the CDC recommendations, was incredible, and I'm thankful for their astute leadership. On March 27th, the Nez Perce Tribe issued a stay-at-home order for the Nez Perce reservation based on the several confirmed cases of COVID-19 in our region, and that remains in effect until further notice. Under the stay-at-home order, residents are required to stay home for the maximum extent possible. Trips outside the home should be limited to only those of necessity, such as getting essential supplies, groceries and such. This does not mean that an individual cannot go outdoors, but social distancing, remaining at least 6 feet away from another person, must be obtained, and use of public equipment should be avoided. Avoiding concurrent or multiple illnesses at the same time may be detrimental during this time. Please do all that you can to avoid contracting any illness by adhering to social distancing and general hygiene guidelines by the CDC, such as washing your hands for at least 20 to 40 seconds, covering your cough or sneezes with a tissue or into your elbow, and washing your hands thereafter. Staying home if you're ill. Using face masks without symptoms is not necessary at this time. However, there are discussions about whether or not this will become necessary, but it's not recommended currently. We all need to be aware that our measures are not only for ourselves or for our own protection, but we have elders and children and vulnerable populations in our community who require our protection as well. Our people have endured much more than we realize, or at times that we can often fathom. Let us not let our ancestors down for all that they have sacrificed and fought for us to be here today. Let us plan as we are taught to prepare for generations to come. Katsiaia for this opportunity to help protect our people and our community and our region during this unprecedented time. We at Nimiipuu Health are here to help you through this pandemic and beyond. Thank you.